Good afternoon. Thanks for joining us again today. As usual, I will take you through today's statistics. Yesterday, there were 456 positive cases reported, which is 4.7% of the total number of tests, and means that the total overall number of confirmed cases is now 210,008. 138 of the new cases yesterday were in Greater Glasgow and Clyde, 76 in Lanarkshire and 70 in Lothian, and the remaining cases were across 9 other health board areas. 447 patients are currently in hospital, which is 14 fewer than yesterday, and 40 people are in intensive care. That's the same number as yesterday. I can also report that no deaths were reported yesterday of patients who tested positive over the previous 28 days. Of course, as you know by now, we often report a relatively low number of deaths on a Monday because registration offices tend to be closed over the weekend. Since last Friday's update, a total of 10 deaths have been registered, and that takes the total number of deaths registered under the definition that we use in these daily figures to 7,510. And once again today, I want to convey my condolences to everyone who has suffered a bereavement because of COVID. Now, I'm joined today by the Chief Medical Officer, who will shortly help me answer questions. Before that, though, there are 2 issues I want to cover. The first relates to vaccination. We are, of course, as I'm sure you are too, aware that some countries, most recently the Netherlands and the Republic of Ireland, have paused their use of the AstraZeneca vaccine. You might be hearing reports of this in the media, and you might have concerns as a result. So I wanted to take the opportunity today to address this directly. In the UK, the decision to suspend the use of any vaccine is a matter for the Medicines and Healthcare Products Regulatory Agency. The MHRA has confirmed to us that there is no current evidence of an increase in blood clots being caused by the AstraZeneca vaccine. That is the issue that has caused the pause in some other countries. As you would expect, though, the MHRA is continuing to monitor this carefully, and it remains in regular contact with other regulators. There is, however, significant and growing evidence of the benefits of vaccination in reducing death, illness, and we hope now reducing transmission as well. And the vaccination programme continues to make very good progress. So for all these reasons, and based on the advice and opinion of the MHRA, we continue to urge people to come forward for vaccination, including with the AstraZeneca vaccine, when you're invited to do so. Indeed, I can confirm that as of 8:30 this morning, 1,908,991 people in Scotland have received the first dose of the vaccine. That's an increase of 20,294 since yesterday. And in addition, 1,907 people yesterday received the second dose, which brings the total number of second doses now to 161,945. So as of now, virtually all people over the age of 65 have had the first dose of the vaccine, and so too have 53% of 60 to 64-year-olds, 41% of 55 to 59-year-olds, and 33% of 50 to 54-year-olds. As the Health Secretary indicated when she was here on Friday, we expect the pace of vaccination to pick up significantly again this week in line with increased supplies. So we are expecting that taking first and second doses together, there will be around 400,000 vaccinations done over the course of this week. And that represents a significant increase on the level of vaccination that we've seen over the past couple of weeks. And supplies permitting, that increase is likely to continue into April, which means that by the middle of April, we are still on track to have offered a first dose of the vaccine to everybody over the age of 50, all unpaid carers and all adults who have particular underlying health conditions. And that target, when, as I expect, we meet that target, will be a really significant milestone. Now, that rapid progress with vaccination provides all of us with firmer grounds for hope about the weeks and months ahead. We're already seeing the impact of vaccination in reducing deaths, and The major Public Health Scotland study that was published last week in partnership with the University of Glasgow also shows that vaccination can significantly reduce transmission of the virus. And so that gives us greater confidence that as more and more people receive first doses, we will have some scope to relax restrictions, albeit we will still need to do that carefully. Now, that confidence is reinforced by the fact that over the past 3 weeks, as a result of the restrictions that we're all living under, we've been successful in suppressing the virus further. That said, and this is quite an important caveat that I need to inject at this point, it is important to note that over the past week, the past 7 days, we have actually seen a slight increase in cases, and we will be monitoring that carefully, and it does provide us with a reminder that there is still no room for complacency and that our room for manoeuvre is limited. Our priority is, of course, on ensuring that young people can return to school safely, and today, of course, sees a further milestone in that as children in primaries 4 to 7 return to school full-time, which means that all primary school children are now back in school. In addition, the phased return to school for secondary school pupils continues today. Our expectation is that all secondary school children will spend at least a short time in school each week in the short period between now and the Easter holidays. And that is intended to help prepare and reacclimatise young people ahead of the full return to school, which we hope will take place after the Easter holidays. Now, we've taken a number of steps to ensure that the return to school is a safe one. For example, we've maintained a requirement for 2-metre distancing in secondary schools in the period before the Easter break. We've provided guidance on issues like ventilation in school buildings, and we're making twice-weekly tests available to all school and childcare staff and to all older secondary school children. And of course, we recently confirmed that we would work with others in the education sector to extend that testing offer after the Easter break to secondary school children in years 1 to 3 as well. So it will be available after Easter to all secondary school pupils. Now, the next few days I hope will be exciting ones for many children as they see their classmates and their teachers in person again for the first time in months. And I know that the next few days will also come as a relief to many parents. But I wanted to take the opportunity to say how grateful I am to all parents and all school staff for the support they have provided over the past few months. I'm well aware, though, that remote learning together with some in-person learning will continue for all secondary school children before Easter, but I hope that today's further phased return shows that life is slowly, but nevertheless surely beginning to return to some degree of normality. Now, in addition to the phased return to school, we've also started a very cautious easing of the wider lockdown restrictions. On Friday last week, the rules on outdoor meetings changed, meaning that up to 4 people from 2 households can now meet outdoors. I know and I'm very well aware that travel restrictions still mean that not everybody can use this relaxation to see family, but it was good to see some people at least able to use it over the weekend to meet up for Mother's Day. For 12 to 17-year-olds, the rules allow 4 people from up to 4 households to meet outdoors, allowing teenagers to see more of their friends. Outdoor non-contact sports and organised outdoor exercise are also now possible for adults and children aged 12 or over in groups of up to 15 people. And of course, for children under 11 or aged 11 or under, outdoor contact sports are already allowed. Now, tomorrow I'll not be here at 12:15. I'll make a statement to Parliament a bit later in the day, round about 2:15. And in that statement, I will provide some further information about when we expect other restrictions to begin to be lifted. As I said earlier on, our room for manoeuvre is still quite limited, and it's important that I am clear with you about that. However, taking account of that, I will seek to set out some details of what changes we hope to be able to make in early April, hopefully around the 5th of April, and then what further easing we might then expect to see in late April and then mid-May and in much less detail beyond that. Now, we can't provide certainty on everything at this stage, particularly the further into the future we try to look, but we will try to provide as much clarity now as possible. So tomorrow's statement will hopefully help you understand when you can expect to see some of the key early milestones in our route back to normality, and it will include the proposed date for the end of the stay-at-home rule, the reopening of shopping, the reopening of outdoor probably first and then indoor hospitality, and further relaxations to the rules about meeting up with other households. So tomorrow's statement will, I hope, underline the fact that as schools return and as the most severe of the current restrictions ease, things will start to get a fair bit better in the weeks and months ahead. That relaxation of restrictions is something that all of us desperately want to see. But, and this is the point of caution I need to continue to stress to you, we can't afford to simply throw caution to the wind. I know everybody understands that, but it is important that I do continue to stress it. The virus is still out there. We see that particularly in the last week with a slight increase in cases. And of course, the virus is more infectious now than it was when we came out of the lockdown last year. So taking care, being cautious, being sensible really matters if we are to avoid, which we all want to do, letting the virus run ahead of the vaccine. If that happens, then the danger is we end up having to take some steps backwards instead of continuing to move forwards. So you will see that hope that we now have for the future reflected in tomorrow's statement, but also tempered a bit with continued caution, which is just the necessary mix that we need to bring to bear right now to ensure that our momentum out of lockdown might not be as fast as we all wish it could be, but it will be steady and firmly moving in a forward direction. But for now, the overall message continues to be to stay at home except for essential purposes. We're continuing to ask people not to meet up with other households indoors. And if you do meet outdoors, then make sure you are complying with the 4 people from 2 households. And on any occasion when you are out, remember the facts advice. Wear a face covering, avoid places that are crowded, clean your hands and surfaces regularly. Perhaps this is a time to remind ourselves to do that as we start going out and about a bit more. Use 2-metre distancing, and of course it's still really important to remember to self-isolate and get tested if you have any of the symptoms of COVID. But for now, please stay at home as much as possible so that we continue that downward pressure on the virus as our vaccination programme picks up pace again this week and gets to as many people as possible as quickly as possible. So thank you again for everything you're doing. I know it gets more frustrating and we all get more impatient every day that passes, but we are going, we hope, in the right direction, and if we stick with it, then by the summer I'm very hopeful that we will have a greater, much greater perhaps, degree of normality in our everyday lives. So thank you very much for listening. We'll now move straight to questions, and the CMO will help me answer them. First up today is Lucy White from BBC.
Good afternoon. On the return of schools, First Minister, more pupils go back today, but as you mentioned, some went back 3 weeks ago. And you also talked about a slight uptick in cases last week. Can we rule out that those 2 things are connected? And we're also already hearing of pupils and of classes having to isolate, and we know that happened quite a lot last term. Is that something that you'd look at changing the 10-day period of isolation for school pupils, particularly with the success of the vaccination programme and particularly with the disruption that's already been caused to their learning?
The CMO may want to say a bit more than I do on this, but on the first part of your question, can we rule out a link between schools partially reopening and a bit of an uptick in cases? No, I don't think we can, and that will not be because particularly of transmission within schools, but we know that when schools open, there is just a little bit more movement generally as parents take children to school, for example. So there is no easing of restrictions, none at all, that are neutral. As soon as people start to move around a bit more, come into contact with others, then there is that risk of transmission increasing, which is why we have to be so careful and cautious, and why it is important that we give ourselves a bit of time between one significant easing of restrictions and then any future easing of restrictions so that we can monitor the impact that they have. And that's what we will continue to seek to do. Obviously, the more people that are vaccinated, the more the vaccination starts to operate as a suppression on transmission as well. But getting all of these things in sync is not an easy task, but it is the one we have to try to do as best we can. On the wider points about school return and isolation, as long as we're still living with this virus and as long as it is still out there, we all face the potential of being asked to self-isolate if we get the virus or if we come into close contact with people who have the virus. Obviously, those risks reduce the less of the virus that we have circulating. But that's a really important part of our overall protection against COVID, that need to self-isolate, get tested and break the chains of transmission. And that applies to young people just as it applies to adults as well. But the more we keep community transmission at bay, the less risk there will be and the fewer pupils that are going to be in that position of self-isolating. And we obviously want to keep that to a minimum. There's no plans at the moment to change the 10-day period because that is what the advice tells us is necessary to stop or to minimise the risk of transmission. But all of these things are kept under review with expert advice informing the decisions we take. But key to this is keeping community transmission low. The lower community transmission is, the less risk there is of school pupils getting the virus, the less risk there is of having transmission in hospitals or other institutional settings. And that, keeping community transmission at bay, of course, is down, as it always has been, to all of us. Gregor.
We were always aware that as schools went back, there was always the possibility that we would start to see a slight rise in cases. And if you look at the data over the last 7 days, we had just over 4,000 cases, 4,009 cases across Scotland. Previous 7 days to that, there were 3,529 cases. So we've seen a rise, but if I'm being honest with you, the rise isn't as great as I had wondered that we might see within that same period. And when the First Minister says that the likelihood of where that rise comes from, when we analyse the data as to what age groups are particularly are impacted by that, it tends to be the working age groups. It's particularly the most common age group for cases just now is between the ages of 25 and 44, so that working age population. And we knew that as schools went back, it was always going to be the possibility that as people could go about their lives more, there would be more contact in one sort of another, and that could lead to more transmission. And I think this is exactly what we're seeing being played through in the figures just now. We need to continue to monitor that, but at this point in time, although there's been a rise, I'm not overly concerned at the extent of that rise. We need just to continue to monitor it. In relation to the isolation period that you mentioned as well, I think it's really important that we continue that 10-day isolation period just now for anyone who has either been infected or identified as a contact, because we want to make sure that we maximise the opportunity for cutting out these chains of transmission as soon as we identify them. That way we can properly safeguard the likelihood of more and more cases being identified across the community. It's those community cases, it's community transmission that will drive the number of cases that we see across any institution, whether that be within a school setting, whether that be in a hospital, whether that be in, for instance, a prison or whatever. It's the influence of that background community transmission that has the greatest influence on the likelihood of infections within those settings.
Ross Govins from STV.
Afternoon, First Minister. You've already mentioned the suspension of the AstraZeneca vaccine in some European countries. Are you concerned it could affect the take-up here and people's confidence in the vaccine, especially amongst groups who've already shown a reluctance to actually have the vaccine?
I'm going to hand over pretty quickly to the Chief Medical Officer, because I think it's probably better people hear from a clinician on matters as sensitive as this. But can I just assure people that I ask lots of questions about these things because I want to be able to stand here and give assurances to the public as First Minister. I'm not a clinician, I'm not a scientist, so it's important that I get the reassurances so that I can pass them on to the public. And based on what I know right now, I can stand here and say that people should feel as confident now to come forward and get the AstraZeneca vaccine as they have done since the start of the vaccination programme. And you have my assurance that if the advice to me ever changes on that, then I would be very straight with the public as a result of that. But the MHRA, which is the regulatory authority in the UK, is clear that there is no cause for suspension of it right now. In fact, At the moment, that's the position of the European Medicines Agency as well, although some countries are taking a slightly different approach. So I just want to be clear that my advice to anybody who's been asked to come forward for vaccination right now, whether it's with the AstraZeneca vaccine or the Pfizer vaccine, you should come forward when invited, because the benefits of this vaccine in reducing your risk of illness and your risk of dying from COVID, and also reducing the risks of transmission, are significant, and that's what really matters right now. So that's the position that I would say and state very clearly, but as I say, I think it's important that you hear also from the Chief Medical Officer.
Thanks, First Minister. So the first thing I want to state absolutely without any doubt is I remain wholly confident in the AstraZeneca vaccine as part of our overall COVID-19 vaccination programme. It's important to state at this point that there has been no causal link identified between any of these incidents in the AstraZeneca vaccine, and that the safety regulatory agencies, both in Europe and in the UK, continue to maintain that we should continue to use this vaccine, because they do not have any data to suggest that there is a link between these incidents of blood clots and the use of the vaccine. And in fact, the WHO came out and said something very similar over the course of the weekend as well. So, as I say, I think it's important that we categorically say and state that we remain confident in that programme. We have a really good system of adverse event reporting within the UK. It's called the yellow card system. We use it for all medicines. It's particularly important whenever we introduce any new medicines, any new vaccines into common usage. And if clinicians are concerned at any effect at all, whether they think it's linked to the use of the new medicine or the vaccine, they can use this yellow card to notify the MHRA of that particular event. And the MHRA continually review the data that is sent to them by the clinicians of all these events, looking for any associations between these and the use of the medicine. And what we can say at this point in time, when you look at the data, particularly around about blood clots, both in Europe and in the UK, is that there is no more, it's no more common to have an episode of blood clot than you would see in the general population. In fact, it's somewhat less, if we've been honest with the number of cases that are being identified here. Around about 1 in 1,000, between 1 and 2 in 1,000 people in any given year would suffer a blood clot. And of the 17 million or so vaccinations that have been given by this AstraZeneca vaccine so far, we're not seeing any signal coming through whatsoever that suggests there's any more than expected blood clots within that population. And that's the really important and critical point in all of this. Is what we're looking for is we're looking for any signs of any incidence, disease, event that would be more than you would expect in the normal population when you're taking such a massive vaccination programme across a whole population. Because people in that population are going to become ill anyway. They're going to have events that they would have had whether they had the vaccine or not. And what we're looking for, particularly with this data, what the MHRA, what the EMA will be looking for, is any signs of those events being over and above what they expected, and they are not seeing that. They'll continue to monitor. It's right that we continue to do that. That's what the yellow card system is there for. But at this point in time, categorically, the AstraZeneca vaccine, there is no evidence at all of causality between this, these small number of reported incidents and its continued use.
Thanks, Gregor. And final point from me on this, for what it's worth, which may not be much to many people, I personally am in the age group that will be vaccinated before mid-April, so I'm hoping to see my blue envelope appear at some point over the next couple of weeks. As soon as I get that invitation to go to be vaccinated, I will be there without hesitation, regardless of which of the vaccines I'm being offered. And I would urge everybody who's getting the invitation to come and be vaccinated to get vaccinated, because it provides you and people you love and people that hopefully over the next weeks and months you'll be interacting more with significant protection, and that is really important. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, the picture on return to schools, the picture across the south of Scotland is a little mixed, but we know, for example, that the Scottish Borders Council have said they will aim that in S1 and S3 at least one full day back in school. Now, you said this will give pupils the chance to reacclimatise with school, But they're going to do that, then they're going to have some holiday, and then they'll have to go back to school again. Will that mean they'll have to acclimatise once again? And doesn't this perhaps suggest that when the biggest teaching union in Scotland, the EIS, said this was a political decision rather than based on education, they might have a point?
I listen very carefully to the EIS on everything related to education, but let me say quite clearly, I don't think they're right on that. And I know the motivations for the decisions I and the government take. It's not political. It's about getting children back to school, back to interacting with their friends, and back to something much closer to normal life as quickly as possible. That's the only motivation we have here. And I think it's a really important one. Now, what you've just outlined there, unfortunately, I suppose illustrates the reality we're living with just now. Nothing's perfect. I wish children were back at school absolutely normally without having to live with any mitigations and restrictions, but we're in a pandemic of a virus, so that's not possible. So we're trying within the constraints of that to get as much normality as possible. I think it's really positive that all primary school children are back at school, that early years education is back as normal, and we want now to get secondary school pupils back as normal as well. In terms of we can't, because given the state of the virus right now, we need at the moment until Easter to continue to have 2 metre physical distancing in schools. We can't have everybody back all of the time. So the senior phase has been given priority for in-school learning because they have national qualifications. But we took the decision that rather than have the junior school, the S1 to S3 pupils, with no in-school time between now and Easter, that we would try to get some, albeit limited, time in school so that they do have, before the Easter break, a bit of a chance to get back into school, to see teachers face to face, to see some of their friends again. I was struck, I don't have his name in front of me right now, but I was struck with by an interview I saw on the telly last week from a head teacher who said that there is real benefit to that, no matter how limited the time in school right now. Getting young people back into school is really important. Yes, then there will be the Easter break, and I'm sure kids across the country are looking forward to some holiday time because there's been a lot of pressure around remote learning and homeschooling. And then hopefully, all being well, we get that full-time return after the Easter break. Is any of that perfect? No. Is anything in life right now perfect? No. But it is a cautious, balanced approach that prioritises getting young people back into education. And I think that is really important, and that's why I stand full square behind the decisions that the government has taken on this, obviously in consultation with partners through the Education Recovery Group, which is chaired, as you know, by the Deputy First Minister. Nicole Cassells from Central FM.
Good afternoon, First Minister. So just wanted to ask, in terms of the Old Firm match that may or may not be going ahead, the clubs have already issued statements themselves and posted on their social media urging fans to try and stay home. So it seems like they've done as much as they can do just now to try and prevent fans from coming to the stadium. So I would like to know what the government and the police will be doing differently this time in regards to what happened last weekend, and how likely is the match to happen just now?
Final decision on whether the match will take place or not. I welcome the statements by both Rangers, and of course it was Rangers fans that were gathering a week or so ago, and also the statements that were made yesterday by Celtic, urging and being very direct in their urging to fans to stay at home. I hope the clubs will continue that over the next few days. It's not just a one statement and the work is done. As we know from experience of the last year, these communications are really important on an ongoing basis. I spoke to the Chief Constable personally last week about his views on what might transpire if the Old Firm match goes ahead. Justice Secretary has been in contact with the police. We will be in further contact with the police over the course of this week. They will have intelligence of their own about whether it appears to them that fans in the main are following the advice of the clubs and staying at home, or whether there is a significant risk of fans coming out to gather. On the basis of all of that, we will have to take a judgment. I don't want to be in a position, I never want to be in a position of standing here saying football matches can't go ahead, or any of the other things that we really enjoy in life can't go ahead. But that's the reality while we're still in this position. And big gatherings, we know, presents a risk of transmission, and we're trying to get transmission down as low as possible so that we can open up all of the things we enjoy doing. And every time we have something that is, something that we would rather not have happened, and something that poses a big risk of transmission, we run the risk of setting our progress back. So that's why we have to be really careful and considered about this. And I think a lot of people felt very aggrieved at what happened a week past Sunday and Saturday. And understandably so, because everybody's still living under these difficult restrictions. There will be some people will have managed to see their mum for Mother's Day because outdoors, because they live close enough. Others will not have. So we all just need to recognise the reality of what we're living with. So these will be judgments that we take in the round over the course of the next few days. Phil McDonald from Central.
Hi, thanks, First Minister. As you'll probably be aware, hospitality businesses in Scotland have set out their proposal for reopening after lockdown, essentially calling for the same approach that's being taken in England. Can I ask, are you considering any changes to level 3 of the tiered system as they are asking?
I'll set that out tomorrow, Phil. And yeah, we have, and I'm not saying anything I've not said before, as well as deciding when we think, hopefully, the whole of the country that's currently in level 4 will be able to come down to level 3. We've been looking at, based on our experience, based on the greater transmissibility of the virus, whether we need to modify the content of the levels. So that's been part of the process we've been undertaking, but I'll set that out to Parliament tomorrow. Callum Clark from Bauer.
Good afternoon, First Minister. I just wanted to go back to policing. There's obviously been a lot of discussion online about the Metropolitan Police response to the Sarah Everard vigil in London, and of course in Scotland the week before Glasgow there was large crowds forming with regards to Rangers fans. Seem to be two different police approaches between Metropolitan Police and Police Scotland. Do you think it would be fair for members of the public watching that to form the view that within the UK policing there is one rule for responding to large crowds of predominantly women and another of large crowds made up of predominantly men?
Look, I, as a woman, understand and actually share the anger that many women feel about a sense and a reality that we're not always safe to walk the streets in the way that men are and take for granted. I'm not going to get into commenting on the approach the Met took. I understand why many people were distressed at the scenes that unfolded on Saturday night, but I'm not responsible for the Met, and therefore it is probably appropriate that I don't comment any further on that. Obviously, in very different circumstances with the football scenes the weekend before, Police Scotland also got criticism of the approach they took. I think the only thing I would say is that these are never easy judgments for the police, but they are very different, obviously, situations. Women feel rightly angry and frustrated for too long, certainly since I was a young girl. The experience for women is that, you get told from a very young age that you're not always safe on the streets, and that the onus is on you to think about how you mitigate the risks you face and make yourself safer. And I think there is an overwhelming feeling now that has to change, that the conversations have to be less about what women do to keep themselves safe and what more men can do to stop posing a risk to women's safety. So there's bigger issues there that are urgent issues that go beyond the debate about the policing of a demonstration at the weekend. And I certainly hope very much, although we've been here before, so I think we all perhaps equally have a bit of a scepticism, but I hope this can be a watershed moment, because none of us want to see future generations of girls having to live with the same fears and the same constraints on life as past generations have. So let's hope that this debate that we've seen unfold in the wake of the tragic murder of Sarah Everard moves forward in a positive way. Obviously, the COVID issues have impacted on some of the debates around policing, and I'm sure we'll continue to see that in the days to come. Tom Eden from PA.
Thank you, First Minister. Good afternoon to you both. Since the daily vaccination figures started being released back in mid-January, the total number of Sunday vaccinations is almost half those carried out midweek. I think it's about 160,000 against 314,000. A few weeks ago, you weren't sure what was causing the discrepancy. Are you now any clearer as to why these drops are happening? And is anything further being done to address it, or should we be resigned to fewer vaccinations being administered on Sundays? And just for the CMO, have you noticed any impact on the infection rate linked to the mass gathering of Rangers fans in Glasgow last weekend?
I'll hand over to Gregor in a second. There will be a rhythm in the week, and perhaps we will see slightly fewer on Sundays, although we try to maximise that. But the thing we're trying to do is maximise across the entirety of a week the number of vaccinations we do, so that we are vaccinating as quickly as supplies allow, and to do that over a 7-day period. Now, when we had the supplies at a level that allowed us to we didn't quite hit 400,000 in a week, but we got close to it in the week where the bad weather just kept us underneath it. But when we got to that point, we had the fastest vaccination programme, not just in the UK, but probably in the whole of Europe. The rate of vaccination has dipped since then, as we predicted it would, because supplies have dipped since then. This week we will get it back up. 400,000 is roughly what we expect over this coming week. There will be a daily fluctuation. It won't be exactly the same number every day, but that weekly figure is the one that we are seeking to hit, and that's what we'll be focusing on this week, and then maintaining that as we go into that mid-April point where we aim to have completed the whole of the JCVI prioritisation list. I'll hand over to Gregor on the point about transmission rates.
Okay, thanks, Tom. I think it's still too early to know the full picture of the impact of the events of last weekend in terms of the infection case rate through particularly the West Central Scotland. What we are seeing over this last 7 days, however, is an increase in the number of cases that we're associating with many of those areas, particularly with upticks across Lanarkshire, across Glasgow City in particular, and parts of Ayrshire and Arran as well. How closely we can associate that with the events of last weekend is at this stage difficult, but during the interviews that the contact tracing teams are having with people who have tested positive, there are a small number who are revealing that they either took part in those celebrations or were involved in house parties that arose from those as well. So we can't say that it's not had an effect at this stage, because at this moment in time we are seeing a rise in cases. As I say, still too early to tell. We've got to remember that the incubation period for this virus is anything up to the kind of 10-day or so period. So what happens over coming days as well is going to be fairly revealing in that sense.
Thanks. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. You said recently you would like to see Scotland leave lockdown as one country. I just wonder if it might be possible to get an update on whether you think that the latest data will allow you to do that, and also how would you respond to concerns that from people in rural areas that they might be sort of held back because of higher rates in more urban areas. I was just looking at the figures, and it's 7 times more cases per 100,000 in Glasgow than there are in the borders, for example. And also just related to that, I know Shetland and Orkney are in level 3 rather than level 4, but the data shows there hasn't been any cases at all there over the past week. So how can you justify keeping the island areas in a sort of very restrictive tier when it appears they've effectively eliminated it? Thanks.
Look, I'll cover this tomorrow. I'm not going to go into any further detail than I've already done. I'll make a general point that whether you've got the kind of prevalence that we've got in Glasgow right now, or the prevalence we've got in the borders or in the islands, that has only been achieved because of restrictions. As soon as we start to lift restrictions, transmission will increase. And we know this is a faster spreading variant of the virus than the one we faced coming out of lockdown last year. So that's what we have to balance. Just because an area's got low prevalence right now does not mean they will stay there once we start to ease restrictions, which is why one of the really important milestones for us is that mid-April point when we will have vaccinated everybody on the initial JCVI priority list, about 3.5 million adults in Scotland. And it's at that point that we think that we will have greater scope to start significantly easing restrictions, because the vaccine will then do the job to some extent, perhaps not completely, but to some extent will do the job of the lockdown restrictions. So, you know, there may be a sense of frustration for areas that feel they're at a much lower level of prevalence right now, having to wait until we get to a greater number of people vaccinated before they see significant easing up. But that's because if we allow the easing of lockdown to get ahead of the vaccine, the virus will overpower us again. And that's what we're trying to avoid. So there's lots of balancing that we need to try to do here, so that even if the lockdown easing is not as fast as we all want it to be, and I want it to be fast just like everybody else does, then at least it will be steady and one directional. The last thing I want, if we can possibly avoid it, is to take one step forward and 2 steps back. We want to keep moving forward. So that's the balance that we're trying to strike in the best place we possibly can. Do you want to say any more?
Yeah, I mean, I think just in the vaccine effect, we're seeing some really encouraging signs just now, both in terms of, you know, we've previously reported on the impact that the vaccination programme is having on hospitalisation rates, and more recently on some of the mortality figures that we've been reporting on a weekly basis as well, particularly through the NRS data. And we're seeing, particularly in those older age groups who have already had their vaccine, really quite a significant reduction in both hospitalisations and in deaths in that age group as well. That's a fantastic start with the vaccination programme, particularly at the stage that we're at, and after largely, for the majority of people, still one dose of that. More recently, I'm becoming more and more encouraged and excited about some of the transmission data that we're starting to see coming through Public Health Scotland, and some of the research team from University of Edinburgh. Again, had a pre-publication paper which went live, I think, on Friday of last week, which again demonstrates that when we're looking at largely after first dose, almost up to a kind of 60% reduction in transmission for some people with that first dose. And again, we've got to take this as a really encouraging sign that this is a big step forward in our understanding of what the vaccination programme may be able to contribute. This is early data. We need more data to be able to firm up some of the conclusions that arise from this and other studies. But at this moment in time, certainly all the signs are that vaccination is going to have an effect not only on hospitalisation and on mortality, but should have an impact that's fairly significant on the transmission rates as well. And that is going to help us to exit these lockdown restrictions that we've all been faced with over the last 12 months and really do the heavy lifting for us. I still think there will be a need for some public health measures in some respect. We've grown used to making sure we're washing our hands regularly, we're wearing face coverings, we're taking care when we're out in more crowded places. I think for some time yet, it's right that we continue to think that that's going to be with us. But certainly at this stage in time, as we look forward to the rest of this year, I think there are really optimistic signs that the vaccination campaign, as we vaccinate more and more people across the country with the first and the second doses, as we work through these different age groups, as we start to get below 50 as well, we're going to see some encouraging signs that the vaccination programme is going to allow us to kind of free up the restrictions we've become used to.
Tom Martin from the Express.
Hi. Good afternoon. Thank you, First Minister. Just following up on a point you sort of was discussed earlier relating to the hospitality industry. You may have seen the Scottish Retail Consortium likewise this morning calling for a loosening of restrictions. In particular, they seem to think we could maybe move a bit sooner in relation to click and collect and food to go services. I just wondered what's your reaction to that?
I had a roundtable meeting with the Scottish Retail Consortium personally last week, so many of these points we discussed there. I'm not going to go further than I have today because I have to set out the detail to Parliament tomorrow, but you know, my response and the government's position on maybe not all of these points, but on some of these points will be clear when I set it out to Parliament tomorrow. Obviously, the Cabinet has got to take the final decision tomorrow morning before I do so. Christine Lavelle from The Sun.
Thank you, First Minister. It's been a few weeks now since the UK government set out its aim for easing all restrictions by the 21st of June. We're a bit further on now, so do you think that 21st of June date for removing the restrictions or sometime around then is realistic or even a possibility? And also, there were reports over the weekend that an increase in vaccine supplies means everyone over the age of 40 could be offered their first dose by Easter. I just wondered if you expect this to be the case for Scotland too, and will your lockdown easing timetable take this into account?
Well, firstly, as you've probably gathered by now, I speak for the Scottish Government, not the UK Government. I don't know what they based the 21st of June day on, so it's probably better to ask them that. I will set out tomorrow what I think is realistic and feasible, and try to give as much clarity for as far ahead as is possible to do. But I'm not going to try to pull the wool over people's eyes. We remain in a volatile situation, and therefore we've got to continue to be careful as how we, in terms of how we come out of this lockdown. But I'll set out the detail of that tomorrow. We will vaccinate as quickly as possible. The targets we are working on right now, based on the supply projections we have, is the JCVI priority list by mid-April. That's everybody over 50, unpaid carers, every adult with an underlying health condition. That's about 3.5 million people out of the 4.5 million adults in Scotland. And then the whole adult population by the end of July. If the supply projections change and allow us to do that faster, we will do that faster, but we will make those projections on the basis of as concrete information as it's possible to get, to give people as much certainty around it as we can. Alistair Grant from the Herald.
Hi there, thanks very much. It's been touched on a little bit, but I just wanted to ask about the rise in cases in the 20 to 24 and 25 to 44 age groups in Scotland since March. It's just something that we should be concerned about. And is there any particular reasons behind this, considering a lot of these people will presumably still be working from home? Does it suggest, for example, that maybe those age groups are flouting lockdown rules? Thanks.
I'll hand over to Gregor. I'm not sure we can give much more insight than we have already done. Is it a concern? Any increase in cases is obviously a concern because it runs the risk of the virus starting to gain momentum again, which is why I keep saying that we can't be complacent. This virus will spread whenever we give it the opportunity to spread. There are some factors that, particularly with the age groups concerned, younger children going back to school, which obviously leads to a little bit more interaction, parents taking kids to school, maybe coming into contact with others. That could be one thing. We don't know yet, as Gregor said, whether the football incidents of last weekend might have an impact there. And it may be, and I understand this, that people, as lockdown gets more frustrating and more difficult, there's just a little bit of easing up on the part of people. While I understand that, it is important to look at that rise in cases and just remind ourselves that we've got to be careful not to allow that to happen.
I think what it emphasises more than anything else, Alistair, is that we can't become complacent about this virus at this point in time. It's easy to slip into a state of mind whereby we think the vaccination programme's going really well. People have sometimes even had the first vaccine and they maybe look upon the risks slightly differently. But I think this emphasises for us really, really clearly that the virus is still there. It hasn't gone away. And if we give it the opportunity to spread by coming into contact with people more often, then it will take that opportunity. And particularly for those age groups who it's still going to be some time yet before they receive their vaccination, it doesn't mean to say that they won't become ill. It doesn't mean to say that they won't be infected with this virus. It doesn't mean to say that they couldn't potentially pass it on to other people as well. So I would ask everybody to remain really, really vigilant and just stick to the measures that we all know are designed to try to reduce the likelihood of further spread happening. Because if we're starting to see this tick up at this stage, it really does mean to say that we've got to be ever more careful and cautious about how we open up from here. Otherwise, there's always the risk that we'll accelerate some of those increases that we've seen. So my plea to everyone is remain vigilant, remain with the measures, make sure that you're taking all the precautions you can to try to limit the ability of this virus to spread further until we get further and further into this vaccination programme.
Turco Crichton from the Record.
Good afternoon, First Minister. Two questions, one COVID related, one not. At Westminster, your Chief Whip stepped aside last week after revelations in the Daily Record. When and where were you first made aware of the allegations of sexual harassment against Patrick Grady? And on COVID, can I press you on hospitality? 5 trade organisations are crying out to be treated the same way as the hospitality industry in England is treated. It's April the 12th when outdoor hospitality is penciled in for England, but April the 26th in Scotland. Is that really fair? And notwithstanding what you've said about having to meet the Cabinet tomorrow and your caution, you did say things could get a fair bit better. Can you offer hospitality any hint of hope today?
On your first question, Turco, there is a formal investigation underway. We have, for the first time now, a formal complaint. I would have had an awareness previously of a concern, but not a formal complaint. I'm not going to say more than that because due process requires that an investigation is allowed to take its course. And secondly, I'm not going to say any more than that because this is a COVID briefing. And if you get further questions on that and we are able to answer them, we can do that separately. I want to treat everybody fairly here, but I want to treat the people of Scotland fairly by making sure we don't allow this virus to get out of control again and set us all back. And that's why I've got a duty to make the best judgments I can based on the situation in Scotland, based on the advice I have, and taking all of that into account. And that's what I will seek to do. I have no interest in keeping any part of the country in lockdown for any longer than is absolutely necessary. But I know, and partly we know this from our experience last year, is that as we come out of lockdown, we run a real risk of things getting away from us again. We've got vaccine now to mitigate against that, but we've got to allow the vaccination programme to do its job. So I will take all of these things into account and I will set out what I think is right for Scotland, and I'll do that to Parliament tomorrow. I do feel very optimistic that by the summer we will all be living with a lot more normality than we are right now, and perhaps a significantly greater degree of normality than we are right now. And it's the vaccine that gives me that confidence. If we didn't have the vaccine, we'd still run this risk of the virus running away from us as we start to ease restrictions. But we still have to do it carefully and cautiously so that we avoid taking one step forward and 2 steps back. Rachel Watson from the Mail.
Thank you, First Minister. It was last month when you first set out your thoughts on easing the lockdown restrictions. Since then, we've seen a slight rise in cases last week. How much does that play into your decision-making and the announcement that you'll make tomorrow? And where are we in relation to how you thought we were when you made that initial announcement? Are we in a better position in relation to cases and hospitalisations, or have we gone backwards?
Clearly, any rise in infections plays into our decision-making. It would be bizarre if, and actually irresponsible if that wasn't the case. But as Gregor said earlier on, we are the slight increase that we've seen in the past week, although we can't ignore it and we should monitor it, is perhaps not as great as we might have worried we would see as schools started to go back. So overall, and Gregor will have his own perspective, I think, you know, with the kind of ups and downs that you always have when you're dealing with an infectious virus, we're not in a worse position overall than I would have expected to be in. You know, if anything, we're in a pretty good position, but this is an infectious virus, so we can't allow thinking we're in quite a strong position right now to allow us just to say, well, we can throw caution to the wind, because a strong position one day against this virus will be a horrendously bad position a week or 2 weeks later if we just decide that we don't any longer have to keep it contained. So that's the position, and I'll set out obviously what all that means in terms of easing restrictions tomorrow.
Rachel, we're dealing with a new virus now in some respects compared to what we were used to when we came out of lockdown during last summer, because the virus that we were used to has almost completely been replaced across Scotland now by the variant that we know as B117, the variant which first arose in Kent, in the southern part of England. And we know that that virus is much more transmissible than the virus that we were used to. So I was really uneasy as we begun to chart that progress as to how would we begin to open society back up again, how would we get kids back into school, what impact would that have and when would we see it? And I have to say that I've been poring over the data every day in minute detail, looking for any kind of signs at all that what we were seeing was representative of a much greater uptick in infections than we have seen. And we have seen a slight increase in infections. But compared to where I thought that and feared that we may, if you look at the range of possibilities, the scenarios that we might have faced, I have to say that, that it's nowhere near as severe as I thought that we would see an increase in infections. That doesn't mean to say that we become complacent. It's really important. We cannot become complacent, because the one thing that we know particularly about this new variant is if we become complacent, it will spread, and it spreads very quickly and very readily. And we know that as a variant, it's associated with a slightly greater risk of hospitalisation as well. So I am optimistic that the signs remain positive, that we are heading in the right direction. We need to be vigilant about what happens from here on in with every change that we make sure that we are having that same degree of scrutiny of the impacts that that has on our case data. Meantime, in the background, we also have the very positive effect that the vaccination programme is having. And as we continue to increase the numbers of people that are vaccinated, we continue to suppress the virus more and reduce the risk of people being hospitalised or having severe illness as a result of things. And it's the balance between those two aspects of, that are in play to make sure that we do this at a pace that is safe enough to make sure that we can be confident that we won't set ourselves back, as the First Minister has already articulated.
Mark McLaughlin from the Times.
Good afternoon, First Minister. The Scotland for the Future report released today said that the coronavirus crisis has made the persistent problem that we've got of Scotland's ageing population even harder to tackle. One of the solutions was to give IVF to families who already have children and to single women who want to be mothers. Can you explain how encouraging people to have bigger families and having more single mothers is going to help Scotland's economy to improve? And does this not go against the kind of global trend? Developing countries are having smaller families. So why is Scotland encouraging people to have larger families?
My apologies, Mark. I'm not up on the detail of the report you've just quoted to me, so I'll come back to you later on any detail on that, rather than try to answer it here and now. Elsa Mishman from the Scotsman.
Thanks, First Minister. A question on vaccines, if I may. I wanted to ask who is responsible for sending out the vaccine appointment letters. There was a delay last week to some of the letters sent out in NHS Lothian, and NHS Lothian had said the letters were the responsibility of the Scottish Government, but the Scottish Government then said that they were told about the delay by NHS Lothian. So I'm just wondering if you could clear up kind of who's in charge of those letters being sent out. And that delay that we were told about, is that a Scotland-wide issue, or was that just unique to NHS Lothian? And if it is Scotland-wide, or even if it's just NHS Lothian, does that have anything to do with the fact that the vaccines that we've seen, the percentage for the 60 to 64-year-olds is about half of that, the percentage that has been covered by 64 to or 65 to 69-year-olds? Is there a reason why that difference is so stark, and could it be to do with those letters being delayed?
I kind of slightly lost you towards the end of your question there. We have been vaccinating in order of age, so you would expect to see an older age group with a higher percentage than a younger age group. Gregor may be able to talk about the issue in detail. I'm not aware of a nationwide issue. Health boards, which is the majority of health boards that are part of the centralised system, will have letters sent out through that, but in terms of whether there is a particular issue with NHS Lothian, I'm happy to, unless Gregor can answer it just now, to look into that and get back to you.
Yeah, also, I mean, I can say a little bit about this. We're aware that there was a delay in some letters being issued to patients in NHS Lothian towards the end of last week. The letters are issued between NHS Lothian, and who provide information, and National Services Scotland, who are one of our national supporting boards. And those, in this instance, there appears to have been some delay in some of those letters reaching patients. We're currently investigating why those delays that took place with NHS Lothian and with NSS, and as I say, we may be able to say a little bit more about that in the future. But that was an isolated impact for people in the Lothian area. I'm not aware of any wider issues that there are across Scotland in relation to that at all.
Okay, thank you, Gregor. Thanks to all the journalists. That completes the questions for today. Thanks, Jill, for your interpretation. Thanks for joining us today. As I indicated earlier on, I'll join you from Parliament tomorrow, round about 2:15, 2:20 is the statement slot in Parliament, where I'll set out as much detail about the pathway back to hopefully a significantly greater degree of normality over the next few weeks. In the meantime, though, be aware of that slight increase in cases that we've seen over the past week, and please try to yourselves or encourage those that you know just to stick with the restrictions just now, so that we can stop that running out of control, and so that we can, while the vaccination programme does its work, continue that move out of lockdown that we're all so desperate to see. Thank you for joining us today, and I will see you again tomorrow. And then, just for some forward planning, if you are interested, back here on Wednesday at 12:15, and then again from Parliament on Thursday. Thanks for now.